the station that's on your side. This is Channel 7 News Daybreak.
Well, by now, you've probably heard the reports of those cases of paralyzing conditions that affect mostly children, and the number of cases appear to be on the rise across the country at times. The condition, it's called Acute Flaccid Myelitis?
Correct.
Okay. Or AFM for short. It appears to be caused by a viral infection, but health officials right now have been unable to link the cases with any single specific virus. It causes symptoms ranging from muscle weakness to complete paralysis. So this morning, explaining it all for you, the latest with Baptist Health, Dr. Devon Ballard of the Sherwood Family Medical Center. I'm sure you've been asked a lot of questions about this, Dr. Ballard, and thanks for coming in to explain a few of these this morning. Okay, so we've heard polio-like symptoms. Anytime I think that word gets thrown out there, it spreads a little fear amongst parents who
super scary.
Remember those days.
Correct.
You know,
I mean, so one of the cases in Minnesota was a kid had a cold, a virus, and then 2 days later he woke up and couldn't move his right arm, and he was a 4-year-old, and Dad was like, "Can you move your right arm?" Couldn't move it at all, so it was completely paralyzed in the right arm. Started progressively getting a little bit worse, and so if something ain't right, you get it looked at.
Sure.
And so the CDC actually has to get involved in a lot of these cases to confirm the diagnosis by some special testing, and then they have their investigators to try to see what's the cause, why is this happening, because it's usually about 1 in a million cases. And so Minnesota last year had 1 case. So why is there 6 cases in a relatively small neighborhood? So that's when you see the movies where the CDC, they investigate to figure out, is there any cause and effect? And the most, there is a virus called enterovirus. It's a respiratory virus that has some association with, after getting this, causing this kind of syndrome in some kids, but not all kids.
Okay.
So it's one of those random, it occurs, but why does it occur so often? But super scary for parents.
Absolutely. So 62 cases is the latest number this year in 22 states. And I think, as you mentioned, although super rare, the fact that it's in 22 states, the randomness of it at times, I think that's another thing that maybe makes parents fear a little bit, even though there's things out there much more concerning and much more pressing.
Correct.
The randomness of this might be one of the causes for fear as well.
Yeah, I mean, in the clusters, like there's a cluster of 8 to 10 in Colorado, a recent cluster in the Minnesota cases, and then Illinois had a little cluster, and maybe through investigation by the CDC, they'll be able to investigate, see if they can actually get a cause and effect. But the presumption is a post-viral kind of reaction where your own immune system reacts to the virus in a certain way that might create antibodies that attack your own system. So it really affects the spinal cord, and it depends on what part of the spinal cord it affects. And so if it's the upper part, it can actually affect your breathing, and there's been some kids pass from it unless they're supported with a ventilator.
All right, let's tell parents out there, this is that time of the year, I mean, kids are coming home with colds galore at this point. That's one of the early symptoms you mentioned for a couple of the cases.
Correct.
At what point would they need to maybe go talk to their doctor?
Well, I mean, if the kid wasn't acting right.
Okay.
I mean, so if it's an older kid, 5, 6, 7, 8, 9-year-old, they can talk to you. But if it's a younger child that can't communicate as well, if things aren't well, if they're not eating like they're supposed to, it doesn't mean they have something really bad like this. Maybe dehydrated. They may need more supportive care if it's a bacterial infection versus a viral infection. But the big thing is, if your kid's sick, keep them at home. Okay. Wash your hands. No direct facial contact if you're sick. Don't drink after people. It's really to avoid exposure and spreading it.
Okay. Thank you so much for coming in and explaining everything this morning for us, Dr. Ballard. We appreciate it. Sherwood Family Medical Center. And you can always contact the Baptist Health Helpline, the number on your screen.